because that is the disease segment in this case. Disease segment in the sense that presently the patient is not passing any fecal matter. So you put your finger inside the proximal segment. This is the mucus fistula. You can see the mucus coming out. So, phir karo. So there are two segments. One is the mucus fistula, which is the distal segment, and the other one is the proximal one, which is the colonic ileal segment. Your finger is going inside?
Yes, sir.
Okay. So this is how you check that there is no blockage, but this is not enough. So how you will test? You will put a Foley's catheter inside and flush it with saline, and then see if the fecal matter is coming out now, and then multiple times so that this starts functioning. And the other way is to put a dye inside and have a visualization of the proximal segment as well as the distal segment. The distal segment you will do it for surgical procedure. That distal segment is patent, which is known as, क्या कहते हैं उसको? Distal cologram. Distal lipogram or distal cologram, depending upon whether it's a colon or it is loop. So distal lipogram will be done just before planning for surgery. But for present, it is not the distal segment which is diseased. It is the proximal segment which is diseased. That is why she is having obstruction. Otherwise, the ileostomy will be functioning. So presently, the ileostomy is not functioning. So how to make it function? First is to see locally. There is no local obstruction externally, but internally we are only able to reach up to about 10 centimeters. So we want to go higher up to 20-30 centimeters and flush it with saline, and then wait, give her time. So if it starts functioning on its own, that is the best option. If it doesn't, then we will try to put dye inside and see where is the obstruction, and after that we will decide what further course of action is needed. So no additional surgery is needed in this case as of now. So what we are going to do is just IV fluids, diastolic suction, and stimulation of the proximal segment. That is the treatment of this. So this is another complication which occurs after a abdominal surgery where you have done a ileostomy. So don't think that ileostomy is a safe procedure. It can have many other complications. It can prolapse, it can recede, it can get blocked, and it can cause intestinal obstruction as it has caused in this case. Thank you very much. Thank you.